Welcome all to our February edition of the TB Think Tank webinar series. This session is titled Evaluating the Influence of the TB Think Tank on South African Policy. A brief introduction to today's speaker. Dr. B. Schmidt is a public health researcher specializing in evidence synthesis, community engagement, and knowledge translation. Her expertise lies in conducting different types of qualitative and quantitative evidence syntheses of public health and health systems interventions. She is also deeply interested in the collaborative design, implementation, and evaluation of community engagement and knowledge translation initiatives that promote inclusive and equitable partnerships for evidence-informed decision-making. Additionally, she is an adjunct senior lecturer at the School of Public Health at the University of Western Cape. And before I hand over to our speaker today, I'd just like to remind everyone that our sessions are now CPD Point accredited. So please do head over to our chat and fill in the form. Over to you, Dr. Schmidt.
Thank you so much, Lwazi. Just going to share my screen. If you could just please confirm that you can see it. Okay. Good afternoon, everyone. As Nolwazi mentioned, I'm B. Schmidt, and I am joined by my colleagues as well online, Chanel and Lillian, who are also part of the evaluation team that was commissioned by the TB Think Tank last year to conduct an evaluation of its third iteration. So in this presentation, I'm going to be taking you through the evaluation objectives, the methods, the results, and the recommendations. And we'll also have an opportunity from the TB Think Tank to share how they've taken some of the recommendations on board. So, as you know, TB remains one of the top 10 causes of death globally. And in our setting, we face various challenges related to reducing or eliminating the burden of TB for many reasons, including social determinants of health as well as health systems challenges. However, in the context of the TB Think Tank, we see this as an important player, as a knowledge translation platform that can bridge the gap in TB-related research, policy, and practice. In our evaluation, we looked at the TB Think Tank as a knowledge translation platform that can bring together different stakeholders who produce evidence as well as use evidence through integrated efforts. So we're looking specifically at Model D, which links to the TB Think Tank's ability to facilitate knowledge exchange, dialogue, and capacity strengthening. We explored a range of the TB Think Tank's activities through the Cochrane's Knowledge Translation Framework. This was just a way of organizing the different activities that it is involved in. So over the past 10 years, the TB Think Tank has become established as a network of TB experts who are dedicated to driving innovative and effective solutions to combating TB by advising the National Department of Health on evidence-based TB prevention and control policy and programs. And an evaluation was conducted previously, which was published in 2018. But last year, the TB Think Tank commissioned an updated evaluation from an independent team of its third iteration, which happened since 2021. And since 2021, the TB Think Tank has implemented key changes, including a revised funding mechanism. There was an establishment of a new executive committee and a secretariat, including a scientist position that was created, and there have been leadership shifts in the task teams and the working groups as well. So this specific evaluation sought to identify areas for improvement and provide actionable recommendations to enhance the TB think tank's role in combating TB in South Africa, specifically since 2021, sorry. So the evaluation describes the characteristics of the TB think tank. It also ascertained perceptions of and experiences of its stakeholders. It determined the TB think tank's influence on national policy and recommendations. It also aimed to identify gaps in research policy uptake, as well as to evaluate its dissemination efforts and to provide recommendations for further strengthening of its work. Data were collected using mixed methods from various stakeholders involved with the TB think tank, including a document review, observations, a survey, and key informant interviews. When it comes to the survey, 65 TB think tank members responded to the survey. 66% of those were female. And generally speaking, the survey respondents were from a variety of stakeholder groups, including 22% being based at research institutions, 17% at NGOs, and 14% at national government. And 83% of the survey respondents were actively involved in the task teams or working groups of the TB think tank. And more than half of the survey respondents were involved in the TB think tank for the past 5 years. When it comes to the interview, 14 TB think tank members were interviewed, half male and female. And interview participants represented different task team and working groups, as well as different stakeholder groups, including the Secretariat, funders, research institutions, advocacy groups, and government. And sorry, there's background noise. And stakeholders were also involved in the TB think tank for a varied number of years, some for longer, but some also actively involved during the third iteration as well. So there was a relatively representative sample of interview participants. Yeah, the different data that we collected, we analyzed using document analysis, thematic analysis, and descriptive statistics. And I'd like to now share some of these results. We really only highlighting a few of these results, and I'd like to welcome you all to read the full report, which is available on the TB Think Tank's website. So 20% and 32% of survey respondents were very satisfied and satisfied with their involvement in the TB think tank's activities. And 77% of respondents said that the TB think tank includes a diverse range of stakeholders in its decision-making processes. Although the remaining 23% highlighted that some stakeholder groups were underrepresented, including district and provincial health practitioners. So, for example, nurses and doctors, patients and advocacy groups, basic scientists and representatives from other government departments, for example, information system or social services. And yeah, the majority of survey respondents, specifically 82%, said that the TB think tank is prioritizing the right things in terms of its role and function. And this is just a summary of what its role and its function includes, which spans across developing, reviewing, and disseminating TB policies and guidelines, building consensus around TB priorities, synthesizing and translating evidence to inform policy changes, advocating for and influencing strategic planning for policy updates, and facilitating networking amongst different stakeholders. Both survey respondents and interview participants named a wide range of activities facilitated by the TB think tank. Just sharing some here, including key niche projects that the TB think tank took on, depending on the priorities identified annually, as well as ongoing activities around sharing knowledge and disseminating outputs from the TB think tank, specific pieces of research being commissioned by the TB think tank, ongoing stakeholder stakeholder engagement, and also its strong input into policy and guideline development. 31% and 40% of survey respondents were very satisfied with the quality of outputs. And then when it comes to the quantity of outputs, 42% of respondents were satisfied with regards to the quantity of the outputs. Here are just examples of the types of key outputs that the TB think tank has been involved in producing in recent years. Interview participants said that outputs were produced using evidence from various sources, including existing World Health Organization documents, available literature, commissioned primary studies, and expert consultations. And 97% of respondents said that the TB think tank was effective in advising the National Department of Health in policy, and 21% and 37% of respondents said that the TB think tank was very effective in identifying and prioritizing research questions. Furthermore, in terms of evidence production and use, 31% and 32% of survey respondents were very satisfied with how effective the TB think tank has been in soliciting and requesting evidence, and when needed, conducting research to guide policy. And 33% and 29% of respondents were very satisfied with how effective the TB think tank has been in collating, reviewing, synthesizing, and evaluating evidence related to policy and implementation. When it comes to the different outputs that the TB think tank produces, these outputs are disseminated via various channels, including the TB think tank website, mailing lists, monthly newsletters, seminars, face-to-face meetings, and so on. And researchers are also provided with the opportunity to report on new scientific publications on a quarterly basis. As well as the TB think tank is, of course, very closely linked to the chair of the National TB Program, who also has a technical support unit that further assists with disseminating outputs to provincial and district levels. In the interviews, as well as in the surveys, people shared a lot of strengths of the TB think tank. I've just drawn some quotes here that may be of interest to you, and I'm just going to maybe read 2 or 3. So someone said that I think it's more of an enhanced support by the National Department of Health. That's what gives the TB think tank its credence. And another person said that it is a community that provides a space where one is kept up to date on key priorities in the TB community, and it also provides opportunities to connect and network. And then various participants also shared that the level of engagement of the chief director with the TB think tank has strengthened the TB think tank, and they've seen a big increase in the number of outputs. So now we're going to share gaps that we identified through the evaluation that can help strengthen the TB think tank, as well as recommendations from the evaluation team. And then we're also going to provide Toko with the opportunity to respond. So I'm just going to share the gaps and recommendations first, and then Toko will respond in relation to them. One of the gaps we identified was the slow production of evidence and uncertainty about the uptake of recommendations. So this really has to do with us recommending a mechanism to ensure that the outputs that are produced within the TB think tank and are submitted to the EXCO and the National Department of Health are followed up for feedback, and their impact is assessed. And then the second gap is that the evidence that is produced within the TB think tank is not always optimally translated into suitable formats. And the recommendation here is for the TB think tank to enhance support in decision-making processes at the National Department of Health and to establish feedback loops on the usability and usefulness of the evidence, and to identify what are appropriate dissemination formats for the National Department of Health. Toko, I'm handing over to you to respond before I go to the next slide.
Okay, thank you. Thank you so much. So in response to the two gaps that were identified on this slide and the recommendations provided, the Secretariat, wants to acknowledge the gaps and also state that we retain a good relationship with the National Department of Health, particularly the National TB Program, and we continuously seek feedback on outputs. Maybe it's also important to note that the TB think tank, its role is mainly to make the recommendations rather than to enforce the implementation. So as such, we think what we can do best from our end is to come up with something like journey mapping of the inputs, and say maybe as we produce some guidelines or produce a plan within that particular document, we set some reasonable milestones that will indicate good progress to just try and help the implementation side, not necessarily to enforce, but to guide and help in such a way that it's easy to identify gaps in implementation and maybe pick up the pieces where it's necessary to make sure everything goes back to the intended plan, to the intended to the intentions of the guidance itself, so that in a way we support implementation, not necessarily enforce it. And also in terms of feedback, the idea here is to create the feedback loop and take advantage maybe of the provincial meetings where we can have a standing agenda, within the agenda we have a slot where we can always provide feedback, seek feedback from the provinces, and also in our meetings that we have with the Chief Director. So that's the commitment that the Secretariat has in terms of these gaps and the recommendations provided. Thank you, and back to you, B.
And then a third gap that we identified is that there's minimal representation of some relevant stakeholders in the TB think tank activities. And here our recommendation is for the TB think tank to seek to include a representation from additional universities and research institutions that aren't maybe participating at this stage, and also to seek further engagement with various levels of government or other government departments that are relevant to the TB think tank's activities, as well as to maybe even understand why some stakeholders, even though this may be they have been invited into the TB think tank, to identify and understand why they haven't necessarily participated, and to address any concerns that they may have in relation to participating, as well as for the TB think tank to explore opportunities for collaborating with HIV stakeholders, as we know that TB and HIV policies link very closely to each other. So these have been some of our recommendations.
Yeah. Okay, no, thanks again. So also to note that the participation in the TP think tank is purely voluntary. So I think we take the recommendations, and we think going forward it might help to be intentional, in looking at the distribution within our task teams and intentionally approaching identified members who can, potentially join those task teams so that we balance the representation. So perhaps it's just to be intentional in our approach while it's voluntary, but we also add the element of reaching out, extending the invitation, and doing the follow-ups.
Yeah. The fourth gap is that we identified was that there may sometimes be conflicting priorities between the National TB program and the funders of the TB think tank. So our recommendation of this is for the TB think tank to promote a balanced approach to funding, to leverage both global funders and local government support, but ensuring that the priorities are clearly defined and managed. And then a fifth gap was that there may be bureaucratic constraints within both the TB think tank and the National Department of Health that could hinder efficiency and clarity in processes. So for the Secretariat to consider how to more effectively support task teams and working groups. And we suggested that, for example, the Secretariat could check in with task team and working group members to identify current gaps in support and communication and how these could be addressed. And the Secretariat can then also clarify how it sees its role and how it can actually realistically support and assist the different requirements of the task teams and the working groups.
Yes. So yeah. So on the issue of funding, we always appreciate the support that we get from the various funders, and there is always a number of funders that are supporting the think tank at any given time. So yeah, the main challenge here is balancing at times the the priorities from the funders and how the think tank generally works, because the priorities that are identified by the think tank always follow the lead of the National Department of Health. And then the task teams, they sit down, they brainstorm, look into those priorities and come up with their work plans, so that the work is informed by the National Department of Health through the robust discussions that also follow within the task teams. But at times you might realize that the identified priorities by the task teams don't quite tally with the priorities of the funders, differ with the differences in perspectives and yeah, all the priorities really. So the response here is to, of course, try to clearly define the processes, how commissioned work gets to be funded, reevaluate how funding is distributed, but always, taking note of the priorities, both of the National Department of Health that we support and also of the funders, and really trying to bring them as close as possible. And then when we speak of the bureaucratic constraints with both the think tank and the NDOH, we think what can help here is the bi-monthly meetings between the Secretariat and the task team leads, and clarifying the lines of communication between the Secretariat and the task team leads. Yeah, we are considering working out a plan to include the frequency, the details in the frequency, and how really to engage so that we bridge that gap. And also, we think we can send out a survey to the members so that it's not only driven by the Secretariat, but we also tap into the ideas that the rest of the think tank members may have, so that we get to address this gap as well. Thanks.
And then further gaps were that there's difficulty for the TB think tank members to access relevant National Department of Health data, which of course affects their ability to provide evidence that can support guidance. And so a recommendation here was for the TB think tank to explore solutions with the National Department of Health on how to access and retrieve data, but potentially to develop a joint data portal or to see how, there could be mechanisms for accessing data, monitoring data requests, etc. And then also another gap was that there are insufficient in-person meetings and challenges around coordinating online meetings. And so a recommendation here is for the task team, for the TB think tank with the task teams and working groups and other members to review and update the support and communication to facilitate these meetings and to potentially increase the in-person meetings while also trying to address some of the challenges that come with online communication.
Yeah. So on the issue of data, I think the Secretariat can act as a liaison, to the NDOH to try and hasten the process for projects, of national relevance. So the program does not own its data. I think that's the main challenge. So the best the Secretariat can do is to act as a liaison in between to try and facilitate those processes. So I think there's also a number of interventions or ideas in that area to try and address these issues at the National Department of Health level, which we also aim to support. And then in terms of insufficient meetings and challenges with coordinating online meetings, so I think the bottom line will be to identify the challenges and try to address them. And again, here we will tap into the survey idea so that we can tap from the wealth of knowledge or ideas from the rest of the TB think tank members. And also, we have considered a second annual meeting that can also be done virtually to try and increase the frequency and address the gap. So we could consider either the face-to-face meeting, which is our annual meeting that brings all the members together, or we also consider the executive committee meetings of longer duration. So we usually have 4 of these, one in each quarter. So we could have 1 or 2 as physical meetings, and we extend the duration so that we address all the issues that need to be addressed in those platforms.
Yeah. And then the last 3 gaps that we identified, there was a gap around lack of monitoring and evaluation of the TB think tank's impact on national policy. So here we suggested strategies, and for example, in monitoring and evaluation strategy or communication strategy, where which would also address the issues we discussed earlier around intentionally engaging specific stakeholders, but also to support communication and dissemination that is more systematic, but importantly, to also monitor the impact of the TB think tanks, input into policy and practice, to really see, the difference that the TB think tank makes to national policy. And then another gap was lack of momentum and commitment within task teams, with voluntary participation not being sufficiently recognized or compensated. So here we recommend that the TB think tank explores mechanism for recognizing individuals who've made significant contributions to specific outputs by formally acknowledging them and attributing efforts to them, particularly for work within the TB think tank that expands beyond the regular duties. And then lastly, we also identified a lack of clarity on the TB think tank's role in relation to implementation research. And so here it's our recommendation is that the TB think tank should clarify or agree upon the scope of its role in policy and guideline implementation. And this particularly also extends to its role in engaging with provincial and district implementers.
Okay, no, thanks. So on the monitoring and evaluation of the think tank's impact on national policy and practice, yeah, we realized that, yeah, indeed, we do not have a monitoring and evaluation plan in place for the think tank generally. So it has been such evaluation. So this is the second evaluation from the first one, which was published back in 2018. So we're considering that since the secretariat is housed within ORAM, we could maybe utilize ORAM's infrastructure so that the M&E support comes from the ORAM data team, or we can consider a consultant who can help us with that. So it's a gap that we see and acknowledge, and we want to take it as recommended. And then on the lack of momentum and commitment within task teams, so for most of our outputs, we do acknowledge, the teams or the individuals who would have contributed, and we realize that certainly that might not be enough. So we think we're going to use the survey again to try and identify or hear from the rest of the members what the ideas are to make sure that we do this to the satisfaction of everyone involved. But we can consider such things as awards and recognition of effort or contribution in our face-to-face meetings, or some various platforms that we may have in place to make sure that everyone is acknowledged for their effort and their contribution. And then the issue of clarity, the think tank, as you may have seen from its vision, mission, goals, and all, its role really is to support the national TP program with evidence-based planning, evidence-based programming, evidence-based development of guidelines and the like. So that's basically the scope of the TP think tank. But where they bled lines, or it's not clear what really we ought to do, we can always clarify in different platforms, like in our meetings, or if people really want to understand what we do, they can always reach out to the secretariat for that kind of clarity. But in terms of the general support that we provide the National TP program, it has to do with providing evidence-based plans and guidance and advice. Not much into the implementation, but we can always support that as per the guidance of the National TP program. Thanks.
Yeah. Thank you, Mtoko. And we've come to the end of our presentation, so I'm just going to hand over back to Nolwazi.
Thank you so much, B, for the presentation, and as well thanks to our program manager, Togo. It is now time for our Q&A session. So if you have any comment or question, please do raise a hand. Pren, I saw your questions and comments in the chat. Would you perhaps like to go first?
Yes, thanks, Nolwazi. I could do that. I mean, I guess some of the issues around uptake of policy. Yes, I agree that it's not the think tank's role to ensure uptake, but perhaps one of the things we could do is ensure that provincial colleagues, DOH colleagues, are involved in the policy development process to a greater extent, so that they're kept abreast of the rationale, and that may help address some of the implementation gap. And then on point 2 around the challenges, around the format not meeting user needs. I think that you've missed the point there. I think what it's referring to is, the think tank develops a long policy document, but in fact, what the folk on the ground need is a one-pager kind of summarizing, the process flow or the algorithm or key points. And that should be easy enough to address by actually looking at not just what the broad policy implications are, but also some of the implementation issues could easily be brought in. And then, I think transparency around what funding is received and what it's for would be useful, because, I mean, clearly, if a donor funds you to do X, you can't, because the task teams want to do Y, you can't change it to Y. But so it would just be clearer where the think tank would need to leverage additional funding that falls outside of what the donors have specified. Thank you.
Thanks, Prin. Either Dr. Schmidt or Mtogo, you guys may respond.
Okay, yeah. No, thank you so much, Prin. Yeah, I think it's helpful to that you pointed out on point 2. So perhaps in addition to the long documents, as you say, we can always shorten it up and try to be on point. I think we did that particularly with the National TB Program Strategic Plan, where apart from the whole plan, we had a summarized version, for a quick read for people to at least, be able to interact with in a much easier way. So yeah, it's a point taken, and we certainly can do that. And also in terms of funding, yes, it is true what you indicate. And I think the biggest challenge for now with think tank is that the funding we have is quite limited, and it's limited to those directed funds that are specific to particular activities within the think tank, and it leaves the rest of the task teams without the necessary support to do what they identify as priorities following the lead of the NTP. So yeah, that's the challenge with the limited funding, and the think tank is trying, of course, to look around and see where alternative sources of funding could be to support that, in addition to what is already covered in terms of the funding. So that's really true. We have directed funds that are specific to certain activities that the think tank is also undertaking.
Thank you, Mtogo. Anyone else with a comment or question? Please do raise your hand and unmute. Or B, do you or your colleague have any almost closing remarks, statements?
I think just if I can just go back, I think to what Prince shared. I think the acknowledgement by the TB think tank for the need for monitoring and evaluation strategies really valuable. I think there are attempts, to monitor and evaluate ongoing work like this evaluation, but I think a more systematic kind of plan could potentially address those first 2 points that you mentioned, Prin. I think just the consideration around which provincial stakeholders should be involved in the TB think tank's activities at what point is something that could be mapped out in a strategy. If you sufficiently sort of think about your activities for the year and then think about who are the people to consult or involve for specific items at specific time points or on an ongoing basis. And I think as well as with the formats, in mapping out or identifying, more intentionally your stakeholders or where there are gaps, you might also identify that some of the gaps linked to the stakeholders are linked to maybe the format. So I think the TB think tank uses a variety of dissemination and communication channels and has a variety of outputs, but I think maybe generating more specific outputs that could be for the benefit of, for example, implementers, even though you're not going to support implementation and it's not rightly not in your scope, could be something that also gets identified in that plan as you plan for the year, to monitor and evaluate who are relevant stakeholders and what are their different needs, how could they be involved in different times and so on. Yeah, that's just one thing that I wanted to add, and I think it's a real strength that you've done the evaluation. This is your second one that you've done, and I think it would be a real strength to also have a more intentional sort of ongoing annual or systematic approach to how you monitor and evaluate your activities. Yeah, and then I think just from Chanel and Lillian and I side who've done the evaluation, I just want to thank, I know that some of the people who are part of the TB think tank are on the score, and I just really want to thank everyone who responded to all our emails and spoke to us. And I think the evaluation has brought out some really key lessons and recommendations, and also given a great example of the need for platforms such as the TB think tank to constantly evaluate themselves. And these are very scarce in our context, so it's really beneficial, and it's been really great engaging with all of you. Thank you so much.
Okay, thank you. Thank you so much. I think we lost Nolwazi. Yeah, so thank you so much, B, for the presentation. Maybe just to alert everyone on our next webinar. So the next webinar is on the 17th of March, and we have Prof. Robin Wood presenting on hunting the boson and finding the BAMOC, rethinking the TB think tank transmission. And we also invite everyone who might want to be part of this webinars and present their work to send an email to Nolwazi on ngosi@tbthinktank.org. So we'll give you back about 18 minutes of your day today. Thank you so much for being part of the webinar, and be on the lookout for the next session and more to come in the next months. Thank you so much and have a great day.
Thanks, colleagues.
Thank you. Bye.
Bye, everyone.
Thank you. Bye.
Thanks, bye.
Bye-bye.